John is a medical student completing his Master of Science in Biomedical Engineering at the University of Alberta. He works as a graduate researcher in the Rehabilitation Robotics Lab, examining wheelchair biomechanics and virtual reality. He writes for the Antarctic Institute of Canada and is co-president of the Canadian Coalition for Global Health Research, Alberta chapter. So John, if you're ready to go, we'll get going.
All right. Can you see my screen here?
Yep.
Perfect. All right. So this is just going to be a quick, short, snappy, sweet little talk. I took out a lot of the rigorous methodology sections and the results sections just for ease of digestion. So without further ado, thank you, Joel, and welcome to my presentation. My name is John, and today I will be reviewing the global public health communication of primary prevention strategies in the civil and global context. Only part of this review, specifically looking at neglected non-pharmacological interventions, will be presented, again, just for digestibility. So how many times have you heard buzzwords like social distancing or contact tracing in the news? These are very integral facets of primary prevention of COVID-19 transmission and infection. However, are there memos here that are maybe being missed or neglected in our public service announcements? Well, I was curious about this, and this is actually exactly what the Joint American College of Academic International Medicine, so the World Academic Council of Emergency Medicine, which is a task force of scientists, medical experts, and public health professionals in COVID-19 were really interested in. And so what they did is they came together and they made a checklist of all of the blind spots in the current global health response measures and public messaging for COVID-19. And so what I basically did was I took a fine comb and brushed through these recommendations and really tried to appraise them. The goal of this project was to translate some of these long, jargon-littered political recommendations into clear, understandable, evidence-based steps. So, without further ado, I basically have skipped a little bit more of the methodologies of the systematic reviews and the PRISMA guidelines and things that we followed, and basically presented to you my results and conclusion here. So here are some steps that you can take right now to fight the pandemic. So number one, exercise. Proper exercise has numerous benefits on the immune system. And essentially, there's been quite a bit of papers that have shown that this is indeed one of the best ways to prevent our immune function from deteriorating. Second, hygiene. As we hear in the news, it's important to stay vigilant, but not to the point where you're hovering over your toilet bowl, because you do need some level of exposure to different types of microbial agents in the environment, just for your immune system to do its push-ups. Third, the COVID-19 literature correlates infection with low levels of vitamin D. And while correlation does not always mean causation, it's generally recommended to get lots of sunshine and vitamin D supplements anyways, especially for us who live in wintry places like Edmonton. Fourth, the proper diet and weight loss strategies, which are yet another important link, because just as COVID-19 is age-related, it's also related to people with comorbidities and obesity, making it extra important to avoid these risk factors. Finally, global stay-at-home measures significantly impacted people's mental health. So there's been several reports of addiction, substance abuse, and in particular, the opioid crisis, which may in part, at least, be explained due to loneliness and feelings of social isolation. So, next time you get exposed to communication like this, remember that there's more to it than just staying home, paranoid, and sedentary. Really try to broaden the aperture and make sure you're shoulder checking to avoid any blind spots. Thank you.